Hello, good morning, everyone. Happy Saturday. So, we're going to try this again. Been having some technical issues this morning, but we're excited. I'm hopeful that it's going to work this time, that we're going to be able to have Kerensa join us and to be doing another live and being able to share. Kerensa's going to share with us a little bit about what brought her to holistic nursing and nurse coaching. And she's also going to be sharing a little bit more about the emotional freedom technique that's going to be being offered through The Kind here in February. One second. Hi, Kerensa.
Hey. I was trying to join you on my computer and it wasn't working. So thankfully, Georgia was helping me, even though she just got out of the shower. I'm like,
that's perfect. I'm so glad it worked. Thank you that she ended up helping you, that we could be here on this Saturday and have some people join us. And the replay will be available too for those who might miss. So whether you're catching it live or you're catching the replay, we're just excited to be here. And I'm so excited to have Kerensa here and to just be able to allow her to just, Kerensa, do you want to start and maybe just share a little bit about who you are and what brought you to holistic nurse coaching to begin with? And then we can get into a few other details, including the EFT program that's going to be launching here in February.
Yeah, sure. So my name is Kerensa. Famous thing I always love to say is that it rhymes with influenza, but not flu. And nurse, for me, that never gets old to kind of share that, icebreaker. So I've been in nursing since 1997, and it led me into palliative care nursing.
Mm-hmm.
And I could really see gaps. And I didn't want there to be gaps, and I wasn't sure how to really go about fixing those gaps. And as I sat with people at end of life, I knew there had to be more than just what we were doing. I knew there had to be something else that I could, hold space for them and show up 100% for them. And so as I really started to look at how can I be more present with them, and also a lot of grief was coming up for nurses and the healthcare profession, and not just the patient and the family that was going through end of life. And so I did a grief and bereavement training first, and I still wasn't sure that it was enough, but it really helped expand that there's other ways of doing end of life. And then I was really scrolling through Facebook, just I'm a prayer warrior, so I was like, okay, God, just help me with this. And so I stumbled upon the American holistic nursing, and then I was asking questions, and somebody tagged Sherry Hole, who's one of the co-founders. And so then from there, we just messaged and really connected. And then lo and behold, I had no idea, but I was registered for cohort 1.
Yes, you were in the first cohort.
Right? Like first cohort through. And as we saw earlier today, so technically challenged and grateful that we were in COVID. And the very first day my son was home. And so he was able to just, really set me up and get me going. And as I sat in cohort, it was the first time that I had felt I was in alignment with who I was as a human being, and that I was really opening up and being aware that I can be a human in my nursing, that nursing is something I do and I can fully be me in it. And then I resigned my position from the palliative care team and started into my own independent practice, but not really having any idea what to do with that. And while I was in cohort 1, many times the questions from palliative patients was, is there alternatives for me to help manage my pain? And so we had a lovely student in cohort 1 named Pam, and she was doing her EFT training and needed a case study. I don't like sharing things with people unless I've gone through it myself. So I don't want to recommend something to a palliative patient and their family unless I've kind of done it myself. So I said, sure, I would love to see what this is all about, and could this be an option for me to offer patients? And I was really skeptical, and I was really skeptical of the holistic world too, thinking it's so woo-woo, and it's not. So I'm great that, you know, those things have really changed for me. But I did my first EFT session, and with COVID being so challenging for us nurses, I was learning to run, but I had hurt myself. And so I couldn't run. And so I hurt my knee. So we brought my knee pain to the EFT session. And the next day, I did my race, and it was so funny because I wrote on this in my care plan, and I based all of this on my care plan in cohort 1 on how to take care of myself as a nurse. And so I raced the next day, I ran the next day, and prior to using EFT, I couldn't even walk a kilometer, never mind run. And so it was one of those really cool things, you know, everybody had all those podcasts out that you could listen to and run along with, because we weren't allowed in person anything, right? Yeah. So I listened to the podcast that ran us through the race, and I didn't realize that they had done the podcast for people that were like basically crawling through. So I was just going and going and going, and then thought, oh yeah, okay, so when 5K is done, they'll stop the race. When I looked on my Fitbit, I had actually run 8 kilometers without pain. And I was actually able to, when I started cramping, I was able to use the EFT that I had learned the day before in my running. And I could feel release and relief, and I was hooked. And so from then I was like, okay, now I need to learn how to do this so that I can help others, because it helps this skeptic. It can help anyone. And then, yeah, right. And so then I went on, after cohort, I trained in level 1, 2, and 3. And then, because I use it all the time, I use it, I got to use it in long-term care. I got to use it in acute care. I got to use it with patients and kind of practice and try and see how things worked. And I was so grateful to see that in end of life space, people benefited from it, and not just the patient, myself, other healthcare professionals, and the caregivers that were caring. And some of those, you know, symptoms or even emotions or even the worries and the fears, they weren't as bad as they were before. And so I knew that I had really found something that was working well for me and for others. And then just a mad passion came from it.
That's so wonderful.
Yeah.
So for those who might not be familiar, can you explain what emotional freedom technique is?
Yeah. So emotional freedom techniques, or EFT as it's often referred to, is also referred to as needleless acupuncture or tapping. And so you're literally using your own fingers, your own hands, and you're tapping on different acupoints throughout your body. And you're tapping on the negative. And so if we think about like chi or life force energy, we each have, you know, this life force energy within us. And if you think of, you know, in terms of nursing talk, pathogen or viruses, we all are familiar with like viruses. So a trauma or a negative emotion or a negative memory works in our body like a virus. So it shows up in our body like a virus or a pathogen in our pathways called meridians, where our life force, our chi energy runs throughout our system. And so then there becomes a blockage in our system. This virus gets in there and it stays in there, and it causes havoc on our bodies and can cause us to be unwell. And it can cause disruptions in our life force energy. And then we're sick. And so when we can use EFT or tapping on those acupoints, we disrupt that blockage. We free that, and we can experience wellness and health with it. And it's so cool to learn about. Yeah.
That's amazing. So is there a specific group of people that would benefit, or who would you say would benefit from something like EFT? And I know that's probably a broad question, but people might be wondering, like, who would benefit from this then?
Yeah, so everyone. Yeah. You know, in the bigger picture. And I think for me, one of the coolest things that I'm most passionate about it is putting it into the hands of healthcare.
Right.
Because we are experiencing, you know, astronomical trauma on a everyday basis, especially when we're in front lines. And so if we can have a tool that it's a self-help tool that we can use to calm our nervous system, to regulate our nervous system, to get that virus out of our system in the moment, we can think clearer, we can make better decisions, we can be more present, and the care that we can give to others is, so much better than the care that we're already giving. Yeah, so I think my answer to that question, Kim, sorry to go on a tangent, is
No.
everyone can benefit. And I've seen it in kids, I've seen it in myself, I've seen it working in different areas in nursing, and I've seen the benefit. Yeah.
And that's the really exciting thing, I think, is because it really can benefit everyone, right? So if we as healthcare professionals are learning it, like I'm excited to learn a little bit more about it here coming up too, and I'll get you to talk about the dates and everything coming up. But I've noticed, even as my son, he's just about to turn 3, and like we're experiencing some bigger emotions. And so yesterday, actually, I was sitting with him on the floor, and I know some of the points, and we were tapping, like, and I was just kind of providing that, and I noticed he was able to kind of regulate his emotions. And I'm always grateful for these complementary integrative modalities and these different tools that we can kind of utilize, because they're so transferable regardless of the situation you're in, right? In your personal, your home life, they can be so powerful, whether you have a partner or an aging parent or whatever, anything, right, that you may be dealing with, young children, older children, adolescents. It's really so wonderful. And then we get to use this in, our professional life too. So that's one of the things I wanted to ask you is, as nurses, I was reading, I believe, and I want you to clarify this for me, is are they starting to implement this into hospitals as well in different provinces? Is that something we're
seen it? I saw it on, it's interesting, I've seen it on Alberta Health. So on our health website, always looking for, is this being implemented? I haven't actually seen any literature to say that it is. However, I did see it on our Alberta Health site, also along with Reiki. And so if it's on our Alberta Health site, then it can, in my thoughts, it could be something that we could, use. They're having it on there as complementary, modalities. And so we're not doing harm when we're using it. And I have been using it myself in those spaces because I had to, in order to, pardon me, to have my own feeling of safety, my own feeling of regulation, I had to. And then people just asked, what are you doing? And it wasn't something that I was, putting it out there for everyone to see, but I was simply trying to manage my own PTSD and my own anxiety. And then it just kind of took off from there. So looking for literature to find, there's a few studies that we've come across. And so when we're looking at our EFT program and how to put that through the nursing lens, finding that information and doing or participating in those, research studies to show how can this work in a facility. I sort of feel like I'm the research study.
Yes, and that's exactly what I wanted to bring up is this is exactly what you are doing with this program that's about to be offered through the Kind is, and you can kind of interject, but that emotional freedom technique through the nursing lens is going to give such a unique perspective specifically for nurses on how to implement this in your personal life, to give you the skills and tools, and also how to bring this modality through that nursing lens so that you can have those conversations with your management, with your leadership, with your regulatory bodies. You can begin to advocate and see how this can fit into, those practice settings, whether, and again, that's going to differentiate a little bit, whether you're an independent practice or you're in a, more kind of traditional setting in your community or bedside nursing. But we really are, it's just as, a number of years ago, we weren't as familiar with holistic nursing and nurse coaching as a modality. Now we're becoming more and more familiar with that. We're seeing more and more nurses trained in that. And it's exciting to see more and more discussion around these different modalities like emotional freedom technique, Reiki, the list kind of goes on. There's so many, but our patients are requesting it. I think that's something we're seeing a lot more. Our patients and clients are wanting to approach their health, especially their, maybe their physical, mental, emotional body in a more holistic manner. People are recognizing the connection between the mind, body, spirit, environment, connection, right? And so we want to address all aspects of our whole self. So Can you share a little bit more about what you're going to be offering in this program that relates specifically to that nursing lens for those nurses who might be interested in how this may be applicable for them?
Yeah, for sure. And so, as nurses, we are bound by our standards of practice and the process. And so, I really had to dive deep into how do I put this through those lenses? How do I literally put this through a nursing lens?
Yeah.
And so, I had to look at our nursing process. I had to look at how do I do an assessment? You know, how do I assess somebody and really understand what's going on with them to determine what kind of an intervention that might be helpful for them in that moment. And so we go through a holistic assessment. We go through how to evaluate things that work for them and don't work for them. And we can kind of get to take a look at where is those viruses, where are those pathogens that are causing the blockage in our life force energy. And really bringing in your intuition. You know, a lot of the times our intuition, our wisdom, our knowledge, our life experiences has to be left at the door. We can't do that because then we become a robot or we're put in a box. So when we can bring all of us present and process our own anxieties and worries and fears alongside the patient, it's so beneficial. And I've seen that when we're spinning out of control, let's talk about burnout, for example, we're spinning out of control, we're overwhelmed and we're burnt out. We can use this tool, this as an intervention or even be proactive in our care. So we're not just working on, you know, we're not fixing anybody. We're not trying to fix anything, but we're looking at getting to the root cause and removing that root cause of things that are causing them to be sick. And then we're also using our nursing documentation. So we're documenting it and in a way, and we're communicating it with physicians, and we can say, you know, these were the these were the things that were happening physically. And I was able to physically use my observation skills and see the changes that were going on. And I can describe it in a way of, you know, mind, body, spirit, but also physically, emotionally, even socially, the things that were going on, all of the things that we as nurses look for when we're assessing an individual in front of us. And we just sometimes have a few minutes to do that. And the cool thing with EFT is it only takes a few minutes to work. So if you even have somebody who's like, you know, really big in their emotion or really big in their symptoms, we can say, hey, let's just do a little tapping, bring that down a little bit, and then we can even look at doing an assessment. So that's sort of how we started building our program, was how do we make it about, you know, implementing all of our things that we do as nurses already and putting it through all of our standards of practice to make sure that it meets, you know, those standards, the highest standards that we have set for nurses. And this program absolutely does, because I've worked really hard to make sure that it does.
Yeah, absolutely. So thank you for sharing that, because I think that's obviously what sets this particular EFT program apart, right? So we want to really emphasize that. Plus, you're going to be in a container of nurses, so you're going to get to talk about, you know, the challenges, the rewards of the career, and how this can be utilized specifically, like in your, you know, again, in your personal life and potentially in your professional life, right? And how you can begin to have those conversations, begin to introduce it. So that's a really other exciting piece. And I think that's also very unique. So let us know if you do have any other questions, and we're happy to answer those specifically about the program. But I know that there are some questions, Kerensa, specifically around some of the logistics of the course. So could you speak to the dates that the course will be running, and then times and the commitment, like the time and energy, and what that'll kind of look like for people?
Yeah, for sure. So Janet is my co-facilitator, and she is out east. And so one of the things that we really looked at, because this is an international delivery, a national and international delivery, we really wanted to have a time that, you know, yes, worked well for us, but also try to have a time that worked well for everyone. So if there was nurses that were in acute care, for example, and they couldn't attend because they were at work during the day, or maybe for those that are working night shift, they might be able to catch a certain time. So the dates are February 12th. It starts February 12th is our first class, and we every week will show up for 8 weeks of in class, and it's from 6:30 to 8. And so in those, sorry, it's 2.5 hours. So in that time frame, in every single class, we will be doing tapping. Every class will be tapping and processing, things that have come up for us. We'll be learning how to, put it through that nursing lens and that nursing process wheel. We'll be learning how to do documentation with it. And we'll be learning techniques that I've sort of used, I guess, as my research to see what would be beneficial to learn. And so we'll be learning hands-on, like skills lab, how to do certain techniques that will really be beneficial in when you're out and about being a nurse, and also in your personal life. Yeah. And then there's, we'll have weekly assignments. So it's important to do the work yourself. Like as a EFT practitioner or in nursing, it's important to do our own work to make sure that we're, clearing our own viruses and pathogens from our system. And so we'll talk about a peace procedure, it's called. And so that is an assignment that is lifelong, and we'll start it right away. And so that is like looking at our own things that are causing us to have viruses or pathogens in our body, like those blockages in our life force, and how do we tap on those so that we can clear ourselves. And then you'll be working with a dyad, which is, so Kim and I would be a dyad together. Okay. So you'll be working with a partner. You'll be doing a video assignment, so we can take a look and see, are you tapping correctly? Where are you struggling? What more do we need to help you with? So we can kind of see how it's going each week, where your struggles are, where your celebrations are, those kinds of things. And it's not a big assignment. It's maybe a half an hour. So it will start with, okay, you're Kim, you and I are dyads, and we just took first class, and now we're going to talk to each other about what is EFT and demonstrate and mark properly those EFT points and understand what they are. And then we're going to dive into a little bit more of the heavier kind of techniques that can pull up some heavy, things that are going on, and tap on those things, but learn those skills so that we have them and can go in and out of, facilities with them. And we decided to do level 1 and 2 together because nurses are so amazing that as soon as they learn something, they want to implement it. They want to use it. But we also wanted to make sure that we recognize we need to be within our scope of practice. And level 1 is all about, the nurse doing the work for themselves. And then level 2 piece is about how do we implement it into our practices. And so we didn't want to just do level 1 and let everybody go, because I know when we talk about EFT, even in cohort, as a student advisor and watching the students' videos, I hear that they're like, yeah, I was using it with this person or this person, and they're not doing anything wrong because it's cool. But we wanted to make sure that they could do it properly and ethically within our, standards and scope. So that's why we put level 1 and 2 together. So when everyone has done their course, they're going to get level 1 and 2 certification. There will also be an open book exam. We didn't make it like a regular old RN exam that we're stressed to the beans to have to write it. It's open book, and it's really just to help us see that you do have a clear understanding. And then there's some case studies. And so then we say, okay, now that you've worked with nurses that are doing the training, we're going to let you loose and have 2 pro bonos and 2 sessions each. And so you don't need to videotape them. Really, you just need to choose somebody that is maybe interested in EFT, or maybe you think might benefit from it, and do a session with them. And go through, so that you do understand how to work with somebody else. Go through that nursing process, go through the documentation piece, go through the assessment, and then, show them what tapping is all about and help them to see that maybe it's something that might benefit them. So that's really the gist of the program, but a lot of hands-on tapping so that the skill is everyone has a really good idea of how to use it and the benefits of it, and also for their own healing work.
Yeah, that's perfect. And so if people are not able to make a class due to a commitment, is there recordings? How does that portion work?
Yeah, so that's something, because of the gist of some of the things that can come up in class. We will talk about that in class, and we'll have a discussion in class. So, um, you know, Kim can't make it to class tonight. If something has come up, is it okay if we record this session? And then the person that's not there will get the link to watch it, so that it doesn't go live for everybody to watch, because sometimes some of the stuff that comes up in class is you know, confidential. Plus, it's also can be a little bit traumatic sometimes. So just to make sure that we're also looking out for the other students that are in class, but also giving that individual an opportunity not to miss out in class. Yeah.
And that's good to know too, right? So that
Yeah.
each, like, you know, it's obviously very highly encouraged that you're able to come to class, but we understand that life happens, and, you know, that we'll work with you, and there'll be an individual kind of, you know, plan made for you if you're not able to make a class. So
Yeah.
those are just a couple of the questions. And so I think that is just so much wonderful information, Kerensa. It's really exciting to see. I was going to actually ask, I know you're holding your phone, but I was going to see if maybe we could even do a short little tapping session just to demonstrate and to have people join in and just have an idea of what it might be like. You can lead me through something, or we can just do something generic, but just to kind of demonstrate for people what EFT is. I know it's
for sure. Yeah, for sure. So cool things about EFT is its techniques.
Mm-hmm.
So there's 48 different techniques that go in EFT. And one of the coolest things that I like about it is that certain acupoints for me will work differently. And so even just knowing what those certain acupoints are, and to show you how you can use it sort of secretly, that nobody knows that you're using it, is simply awesome. And so that's sort of how I get away with using it in my life all the time, and people don't actually know what I'm doing. So that might be a really good starting point. And then you can stack EFT. So you can stack it with another modality, which is really cool. So maybe I'll show you today how we can release some of our constricted breathing as well. And so, yeah, so I'll demonstrate some of the EFT points that I use. So it's called the sore spot. So I don't know if you can kind of see. I don't want to like show boobs and stuff. Kind of the that we need to be looking at, and as nurses, we got it. So if we look at our collarbone and we kind of stick our hands, you know, put your index finger on your collarbone, and then roughly where your ring finger would be, in and around that spot, kind of poke around in that area, and you'll feel that it's like, oh, there's a tender spot there. And so once you kind of feel that it's called your sore spot, once you kind of feel that sore spot, I want you to stick your thumb in it and then stretch your hand out, and you should reach the other side where your sore spot is. Put your thumb in that one sore spot and just lay your hand on your chest. Yep. And with your index finger, if you're poking around on the other side, you'll come pretty much they're right across from each other. You'll find where sore spots are. So you're in a meeting or you're walking down the hall and you just massage them. And so this is really where our lymph nodes are. Lots of lymph is here. And so it's tender because this is where we might have a buildup of fluid. And so it's connected with our lymphatic system. So you're just rubbing it, and you can feel that it's, you know, it's a little tight in there, right? And it doesn't look like you're doing anything big because everybody kind of just, you know, I got a sore shoulder or whatever. So this one is really good for any time. As soon as you start to feel anything happening in your body off your normal baseline, this is a good one to do. Or if you know, oh gosh, I'm going to be live with Kim today, I can give a couple of these and nobody even knows that I'm doing it. Also, the other really cool point to know about is our karate chop, or the side of the hand. And often we refer to it in our program as the side of the hand, but a lot of the time you can hear about it being called the karate chop. And so just for, you know, proper verbiage and being inclusive of individual side of the hand. So between kind of on the side of your hand, that kind of fatty or fleshy part of the side of the hand, if you just tap on that, you can tap on that underneath your desk. You can walk down the hall and tap on it behind your back. And that is a really calming and nice point to tap on. Yep, just like that. I'm going to see if I can prop up my phone. I might not be able to. We'll see. If I lose you, sorry.
That's okay. You can let me know if this is kind of correct.
Yeah, a little bit. So it's like the space between your pinky and kind of the bony nodule on your hand. Yeah, right in that, up a little bit, Kim. Perfect. Yep. So yeah, and if you just kind of put your hand like this, and you can just tap all 4 fingers if you want. Perfect. Yeah, just like that. And so when you're standing, you can put your hands behind your back, and you can tap on that, or you can squeeze that, and that's really helpful. And then on the inside part of your wrist, so if you hold your wrist up, on both sides of the wrist, there's a few acupoints. And so you can simply just take your hand and just tap it. So just tap your whole wrist like that. Yep, just like that. That's a trauma point. And so if you're feeling really big emotions or really big things coming that you feel you're getting dysregulated or in disharmony, tapping on that is really helpful. Or you can tap both wrists together at the same time, so you're hitting all of those acupoints. Like, and so you sort of like you're a butterfly. So you cross your hands like this. Yeah, there you go. And so then you can just tap them like that together. And so that's when an emotion is really big, and that's a really good trauma spot. And so I will often do that under my desk if I'm like, you know, I have that big urge. And so that's a really good one to know.
That is a really good one.
Yeah.
Good to know. Yeah.
And then for little kids, so for little kids, you can just kind of, you know, hold their hand, or just kind of hold onto their wrist and just kind of give them a gentle squeeze. Yeah. And then I want to circle back, Kim, something you asked or that you mentioned about Destin was that you were, you know, tapping on him. On kids, we can visualize the tapping. We don't even actually have to tap on somebody. We can do like surrogate tapping, where we can either be the person to tap on them, or we can sort of go through the tapping points in our mind, and it benefits them. It's really cool to do that. And then with kids, they don't always like the tapping, so you can hold and just kind of put some gentle pressure on them. Okay. And that's something that's, you know, really helpful, because kids are like, what are you doing? That's so weird. And they kind of fight you, right? But if you just gently, you know, we're always touching our kid's face. So if you just kind of gently do it, it can be, you know, helpful. And that's also really nice to know if you have a patient that is not able to do the tapping themselves. You can do it for them, and you can also just gently touch. So we'll do a bit of constricted breathing, and I'll show you the tapping points first. We won't actually tap on them just yet, but I'll show you what are easily landmark. First is on your eyebrow. So if you go to the inner spot of your eyebrow, and when you have glasses on, you can keep them on, that's great. So it's just on the inside of your eyebrow. That is our first one. And you follow along the side, and I just go on the other side of my glasses, and it's sort of where you kind of have a little bit of a divot there. It's just along side, and then you can follow along underneath. And so just underneath my glasses is the next one in that puffy part of our cheek. And then on your lip is if you had a mustache and you're just kind of tapping. I do have a mustache, we all do, so let's just tap on our mustache, it's healthy. This is also a trauma spot, so this is another really good one to be aware of. And anywhere between 5 to even 10 taps. Any of the manuals will say 5 to 7. I find that I actually do about 10 when I'm tapping, and it's your practice, so whatever you're comfortable with. And then we have like the knobby part of our chin. Just above the knobby part of our chin is the next spot. And then we're going to come down to our my collarbone is here, just slightly below that collarbone. And then you tap there. And then under our armpit. So if we go to the side of the arm, if I go to my bra line is here, it's really right where your bra is. And to kind of poke in there where it's soft and where you're like, oh, there it kind of hurts a little bit, that's your spot. And then the top of the head, which I find simply fascinating, the very center of your head is a really important part that kind of governs our whole body. And then there's acupoints all the way around it. So in my own wisdom, I like to do a circle. And now I know why, because I'm actually hitting all of the points. And then on our fingertips, each fingertip has an acupoint. So I try and use my whole hand. So when I'm tapping my head, I will use my whole hand and do it. And I didn't know why. It just felt good. Now I understand. So I do it in a circle and just go around. So that's our tapping points for the rest. And then if you just want to close your eyes and tune into, take a breath, one nice breath, however is comfortable for you. And how is that breath? Is it tight? What does that breath feel like? Is it easy to have a breath? Mine's a little constricted. I'm a little nervous, just to say. And then I want you to take one more breath and see if you can breathe in a little bit bigger, a little deeper. Inhale and then exhale. And then one more breath in. See if you can expand it a little bit more. And then exhale. And then Kim, if you were to rate that breath, how easy was it to take a breath in? How did you feel constriction? And if you were to rate the constriction, the most constricted being 0 and the easiest or most free in your breath being 10, what number would you give it? And you don't need to share, but just notice what that number is. And then we're going to do some tapping on that. So you can gently open your eyes and we'll just kind of go through. And so we're gonna use the side of the hand where Kim demonstrated where that, yep, right there. So then we're gonna tap on that and you're gonna repeat after me and we're gonna say the negative. And so you might notice that you wanna giggle, you might feel some electric shocks, you might sneeze, you might get teary. You might feel a rush of energy, and all of those things are normal. For me, when I'm tapping, my voice starts to get constricted. And that everybody knows, oh, here's Kerensa, something's working in her body because my voice goes, it's kind of funny. So anyways, Kim, yeah, if you can tap on your karate chop and then just repeat after me. And we're going to say the setup statement 3 times. And so it's going to go like this. Even though my breath is tight this morning.
My breath is tight this morning.
I
love, honor,
and accept myself anyway.
And accept myself anyways.
So even though I have constricted
breathing.
Yeah, and my breathing is a little tight this morning.
Breathing is a little tight this morning.
And for me, my number was 6. And I'm at a 6. And so insert the number you want, yeah.
And for me, my number was 7. I'm at a 7.
Perfect. And I'm at a 7 this morning. I love, honor, and accept myself anyways.
I love, honor, and accept myself anyways.
Okay, perfect. We're going to go to the inside of the eye. Constricted breathing.
Constricted breathing.
Breathing is tight.
Breathing is tight.
I'm bringing some relief to my breathing.
Bringing some relief to my breathing.
My lung space is only at a 7.
My lung space is only at a 7.
My breathing is constricted.
My breathing is constricted.
There's something blocking breathing.
There's something blocking my breathing.
And I'm going to release it now. Sorry, under the arm.
I'm going to release it now.
And then we go to the top of the head. This breathing is tight.
This breathing is tight.
My breathing is tight.
My breathing is tight.
My breathing is not as big as I'd like it to be.
My breathing is not as big as I'd like it to be.
My lungs don't have the capacity.
My lungs don't have the capacity
to go past a 7. And I'm feeling tight in my breathing.
And I'm feeling tight in my breathing.
Oh, feeling short of breath.
Feeling short of breath.
Yeah, this tightness I'm feeling.
This tightness I'm feeling.
And it's time to bring.
Some
expansion to my breath now.
Some expansion to my breath.
Okay. And then just take a breath in. And then exhale. And then check in from the first breath. Was there any change in that?
Yeah, it definitely feels like there was some expansion. Like I was just focused and I was like able to open up.
So then you can you can continue with those rounds. And so if you have another number that you come up with, so which is called our SUDS, or our subjective scoring. So we're always evaluating how things are going. Nurses like numbers, right? We like on scale, so we can see if things are working for us. So Kim, if you were to put a number to it, your first number was 7. What would your number be now?
Let's say 8.
Okay. So then that's good. You've expanded those lungs. And so you would keep tapping on that till you came to a 10 out of 10 where your breath was really easy. And so that's just an example of how you could do some stuff with shortness of breath, constricted breathing. Yeah.
That was wonderful. Thank you, Kerensa. You gave us so much information and
you're welcome.
So many practical tips and tools that we can kind of take, right? And just such a glimpse of, I'm sure, what's going to all be in the course. So we'd love to have you join us. And if anyone has questions, please let us know. I don't know if there was anything else that you wanted to share, Kerensa, before we wrap up and kind of tell people where they can find the information to register for the course and how to connect with you if they would like.
Yeah, so to register for the course, you're going to go to thekind.com and you're going to look at the EFT section, and there will be a link there to register. And then we also do have early bird pricing right now until February 1st. And so there's a 30% discount off the regular cost of class. So if you want to take a look at that and take advantage of that, that's a really good way of doing it. And then if you really just want to have a self-help tool as nurses, that's portable, can go anywhere with you and can be used anytime, just to help you feel safe in your environment and learn how to help others. I highly recommend joining us, and we really do look forward to, just helping you feel balanced and in harmony again. So yeah, thanks so much for having me, Kim. That was really great.
That was really wonderful. And thanks, Kerensa, for joining me. I'm glad we were able to connect and get our technology sorted out. And thank you for all the information that you've provided. And if you do have any other questions, feel free to DM us at The Kind or email us. You can connect with Kerensa as well. I'll provide all her, the email and those details in the comments here. But thank you for joining us, and we hope to see you in the EFT program in February.
Take care, everyone. Happy being here. Bye.
Bye.